Today I'm the CEO of Lahey Health Behavioral Services. 20 years ago, I was a clinician in our residential program doing individual and group therapy for individuals with substance abuse and addiction issues. I can say that 20 years ago, it was never my plan to become CEO. But what I came to realize after a year of doing direct care work is that there are incredibly special individuals who can do that work day in and day out. To do the job well means that you have to care about the population that we serve. People come here because they want help. They want to figure out how to navigate a fairly complex system. They want to understand what's going on with them and what services might be available. They need to figure out what level of care. So, do I need a detox? Do I need an inpatient stay? Do I need just a counseling session? Most often people are saying, I know something's not right, I'm just not sure what to do about it. And so they'll come to us and say, can you help me sort that out? So people get to us for many, many different reasons. We don't really care what brings them to us. It's about what we can do and what they're willing to do with us once we have them in treatment. People are often reluctant to access services, one, because of financial concerns, two, because of insurance restrictions. But we find one of the biggest barriers is issues of stigma. Nobody wants to admit either that I have a substance abuse problem, or that my kid has a substance abuse problem, or that my kid is struggling with an emotional issue, or my kid has a mental illness. There's incredible shame in families when it comes to talking about this. It's not something that we share openly. Very few of us can have to look much further than a few feet away to find a family member or a friend who has been struggling. If we look at an individual and try and treat their mental health issues in isolation from their physical health, we're really not treating the whole person. What we know is that 1 in 10 individuals will be impacted by substance use or substance abuse, and that 1 in 5 individuals in the U.S. will have some struggles with mental health during the course of their life. If it goes untreated, we know that their medical costs alone will be anywhere from 2 to 4 times as much as the exact same disease that somebody else might have without a behavioral health issue. As healthcare has evolved and we start to look at the entire needs of a population and the entire needs of an individual, what we're realizing is that to optimize healthcare, we need to start partnering our mental health and behavioral health staff with the medical community. And so becoming part of Lahey Health is really affording us to hit the 2 primary goals that we have. One is to get better health care for behavioral health clients, and the other is to get better behavioral health care for the Lahey patients. Frequently, the 2 of them have been very separate and distinct. We know that on average, a person with serious mental illness dies almost 25 years younger than the average American. And that's a reflection of them not getting the proper health care while they're getting their behavioral health needs met. If we can start to shrink that gap, we're going to make a significant difference in the lives of many people. I think there are 2 things that distinguish us from other people that are doing the same work. One is the array of services that we have. So we don't believe that one size fits all. What I know for sure is that everybody has the ability to get better. That given the right opportunity and the right supports, whether that be treatment, whether that be intervention, whether that be medication, is that everybody has the capacity to get better. And that's why we're here doing this work.